Telehealth Secrets webinar. Today we have an amazing special guest to choose. I think you guys just such a treat. So we have Dr. Rutledge, who's not only the co-founder of HealthTap and the chief medical officer, he was also the co-founder of the WebMD. And then on top of being a practicing ER physician, a PhD in artificial intelligence, which we're going to get into in a really interesting dialogue. The thing you might not know about him is he loves adventure. He, in fact, he's been hang gliding for over 40 years and recently just made a 100-mile cross-country trip at 17,000 feet. I guess Dr. Lucas, really is an honor to have you in our webinar. Thank you so much for joining.
It's my great pleasure to be here, Milton. Thank you. I'm not sure that our hang gliding adventures are going to be the main topic of the conversation today, but I'm happy to share pictures and adventures with others who might want to after.
I think that'd be great. I mean, I think this is where maybe all of us in the healthcare industry having that sense of adventure to break through some of the limitation. That's a good thing. And Dr. I guess we can keep this pretty informal again while we do these things. Again, so by the audience members, feel free to ask questions as you come up during the dialogue. Again, this is such a treat to have such a legendary figure in the healthcare industry to be here with us. Yeah, I guess Dr. is it can I ask you just like, how did you get started in the healthcare and the artificial intelligence? Maybe that would be helpful.
Well, it's certainly true. I shared a passion for technology and this idea that I wanted to be a doctor at a young age. I must admit, when I went to medical school, I really thought I was going to become a researcher focusing on applications of technology in healthcare. And was surprised to discover how much I fell in love with clinical medicine. I went to a clinically focused medical school and found myself really deep in the world of practicing medicine. And actually spent several years both practicing and teaching medicine in academic settings, first at UCSD and then at Stanford. In some ways, I was sort of relayed how much I enjoyed practicing medicine, what it means to be a doctor. But I did return to my original passion. I should quit my faculty job at Stanford and started the PhD there and did the PhD, as you say, in artificial intelligence and medical computer science with this idea that a doctor really understood how to practice medicine would be better positioned to create technology solutions that would actually work and would help doctors achieve the goal that they have of taking better care of patients more efficiently, more effectively. And that's really been the focus of my career in a variety of venues you mentioned. So I actually started out doing research. I had NIH-funded research at Harvard Medical School, and I was doing medical computing when I realized one day that there was a real opportunity. The internet was a new thing in those days, and there was a real opportunity to use technology to deliver better healthcare. And for that to have an impact, it needed to happen at scale. And the way to make that work was through venture-funded new companies. So I actually left my faculty job at Harvard and joined Healthion before it became WebMD. And with the idea we were going to make healthcare better. It was a bit early, it turns out, back then in the late 90s. People weren't quite ready for it. But what did work was the consumer information service. So I had the privilege of building the first consumer health service there, which became what you know now as WebMD.com. Yeah. And that ended up being the only part of their business that ended up gaining traction and led to the success of the company. The parts related to healthcare ended up being too early. I subsequently went on to do work on the provider side. I was a chief medical officer and head of product at Hippocrates, where we were providing information to doctors. And really the incredible opportunity arose when the advent of mobile health and the advent of social created, and the cultural changes that went along with that, which created this opportunity to bring healthcare to mobile devices. And that was really the foundation for the company 10 years ago and got started, not quite 10 years ago, it was 2010 when we started HealthTap with this idea that you ought to be able to do healthcare on your mobile device and that it wouldn't be easy, but that if we systematically build a platform, it would be possible to deliver a healthcare experience for people through their mobile devices.
That's wonderful. And I think so. Like, so right now there's like a rage about like these AI discussions. A lot of physicians feel like at least maybe feel threatened, like in the sense of maybe what AI replaces doctor and so on. Like how's your perspective? Should doctors feel threatened or?
I certainly agree. There's a massive amount of buzz and interest in AI and its applications across the way. I point out that a lot of the healthcare applications of AI have really been focused on areas where there's lots of data. In particular, imaging analysis and interpretation is a big area. But take a step back and say, how is AI really helpful in the process of delivering care? There are point solutions where specific AI technology may be useful. Improved diagnosis of cancer on a breast mammogram, for example, or better diagnosis of images of dermatologic lesions, or even better pathology interpretation, more consistent and coherent pathology slide interpretation. But if you look at the healthcare that people experience, it's really a different world. There, we're talking about the judgment of individual doctors who are taking care of patients. We're talking about the ability of people that have a health problem who don't understand or know much about whether it's important or serious, or do they need to be concerned, or what are the issues, or people that have a diagnosis that want to get more information about the range of treatment options. And on that side, AI has the potential, which we're just starting to see now, to gather and collate information that's relevant to an individual. So if you look, for example, at HealthTap, you see that in addition to having a technology platform that organizes the experience and makes it possible for people to gain access to the information they need, we also have implemented AI as a means of guiding people to an understanding that's more specific to them than could be done through just a search based on search terms and a search phrase. So, for example, this service, the symptom checker service on HealthTap, is an opportunity to interact with an AI agent that starts with the initial problem and then guides you through a series of interview questions to collect the information regarding what might be the possible explanations. And the system is able to understand what possible explanations might be for the symptoms so far, and then look for the other questions to ask that would differentiate among the different possibilities. So AI can be used to guide an understanding of what the range of things that might explain the situation are. You asked about, are doctors afraid of AI? We're pretty far away from this idea that such an interaction could be unguided or unmonitored or direct with an AI agent. What I see as the huge potential is that AI can manage and collect the information and do the things that are on a more routine or automated basis, that the starting point, like if there's a series of things that need to happen that an AI agent can facilitate, asking a series of questions, collecting the information on the interview, asking relevant past issues, collecting more detailed information about the medication history and whether or not you have allergies, and do all that work before you come to the doctor. Suddenly, the time the doctor has is now freed up, because the doctor doesn't have to spend all that time collecting all that information, and instead can focus on the thing that only the doctor can do, which is to understand the meaning of the symptoms you have, look for the things that are unique to the individual, and have a one-on-one conversation with the individual to address the things that are unique to them and their life circumstance, which only a human being can do, because we don't have general knowledge in AI systems. We're not going to have that knowledge of the world. The common sense knowledge is what's missing from AI. So I see AI as an adjunct to support, encourage, and improve. And on the other side, not only can it collect the information, but it can then also remind the doctor of the possible things the doctor needs to be thinking about, rather than taking responsibility for saying, hey, I think it's this, because it's more likely to be, it's not going to be right all the time, if you will. And it may not be well positioned to understand the chance that something less likely but more severe is actually what's going on. And so the doctor becomes the arbiter, the interpreter, and the person who can do that. I want to mention one exciting thing we did here actually was look at this process. We're asking the question, if we have an AI service that can identify the possible explanations, how useful is that? Yeah. So one of the things I tested was, okay, how good are, if we present standard scenarios in encoded form and ask the doctor what's the most likely explanation for that, we get a certain rate that the doctors give us the correct answer, because we're using cases where we know what the correct answer is. And then I tested against the doctors what happens if you show them a randomized list of possible explanations. So you're not telling them what the answer is, but you put in the answer as one of the set of choices that are possible. And what happens? And I was really delighted to see that the percentage correct rate went up dramatically. The doctors, when they're reminded of the possibility to think of, actually perform by recognizing the thing that they didn't immediately think of. That's particularly true for the less common things, because we tend to, the first assumption is that what the problem someone has is the thing that's common, we usually see. And being reminded to think about the things that are less common is a helpful decision aid, and the doctors do a better job when they're shown that. So I was very encouraged by that as a demonstration that AI can actually help doctors come to better decisions for their patients.
Yeah, that makes a lot of sense in there. So, Geoff, do you have I think you have a couple of slides you want to share with the audience, maybe?
I'm happy to let me bring that up here.
Terrific.
I wanted to suggest that what we've seen, and this is sort of taking a step back and looking up at what is it that people are looking for, and what is it that people need to help them in their health journey or with the health problems. If you think about it, people want trusted answers. The information they get, they want to have it be trusted and trustworthy. And to do that at scale and make it free, you can crowdsource that or have a large internet-based source. So for example, when you look at a reference site like Mayo Clinic, it's trusted site, and the information you get there is pretty valuable, and you can expect that the information there is correct and trustworthy, but it's not personalized to you, and you're not sure whether any piece of information that you read about actually is relevant. You don't know which of the information is the right answer for you. What you really want is a personalized answer. But if you look currently or previously at personalized crowdsourced answers, what's available for free, what has been available for free are things like online groups and monitored sources, where the problem is the source of information is not necessarily trustworthy. If you ask for an answer in an online group and another person gives you an answer, it's hard to know how to trust it. Now, a personalized trusted answer would be what happens when you actually see a doctor in person. You trust the individual physician who sees you, and they will give you a personalized answer to your problem, but it's not free, and it's challenging to get to. What we've done at HealthTap is create this intersection in the middle where we crowdsource the trusted information and through the platform give a personalized answer from doctors to people who ask questions and are seeking help to get a trusted answer from a doctor. The system, in effect, I described the use of AI technologies to support the role of the doctor. If you think one way of looking at the way the health platform works is that you start with consumers who are looking for answers, and the first point of interaction is with an AI-based agent, which then guides the connection to the doctor. And then one of the really fascinating things about the digital platform is that by observing, by coding all of these interactions, by having the symptoms represented in a standard form, and giving the doctors the chance to name the correct diagnoses for each circumstance, as the system operates, it collects data which are fed back as training data to improve the operation of the AI system. So the really exciting thing about the initial systems is that these are learning systems and systems that we know will improve their performance as we go on over time. The last thing I want to comment is that you were addressing this before with your question about how doctors view AI. I see among my colleagues a great deal of interest and really excitement about this idea that technology can open up avenues of practice that actually improve the way they practice, enable them to give better care. When I look at how doctors think of, in particular, the virtual care aspect of medicine, there's a series of features that really enthuse the doctors, and I put just a few of them down here. You know, when you have a remote digital technology, you don't have to be in the same room with the doctor, which means you can be anywhere you want, literally anywhere in the world. And we have doctors who, while traveling, when they're visiting a conference in another city, or even when they're traveling abroad to attend a seminar, are able to continue to take care of their patients because they can be anywhere when they practice. And similarly, your patients who may not be able to come and visit you, whether that's because they're infirm at home, have lost their travel ability, or physically are in another location, if they themselves are visiting, then the platform enables you as a doctor to give care to your patients even when they're not able to come and see you. I think doctors appreciate the fact that it's a better experience for their patients. if the patient doesn't have to wait in line and go through the rigmarole that's associated with being in the office, that the improved patient experience is something that makes the doctors happy also. I should mention that a doctor giving virtual care does not have to have the same expenses associated with maintaining a physical office, and all the various staff members in the office are those features are actually taken care of automatically by the platform. And of course, in today's climate, particularly in America, the opportunity for a doctor to expand their practice, engaging and being able to reach out to people through another channel is another way to support the fundamentals, increasing revenue to the practice. Those are the key points I wanted to make there. Milton, I didn't know if you had any questions or wanted to pursue one or another of these points.
Great, Geoff. Sorry, I think I lost internet momentarily. I got this. Sorry about that.
Okay.
Yeah.
Are we still there? Are you?
I'm back in there.
Okay. Yeah. I was asking if there were any aspects of that you wanted to. Milton, I'm not sure if your connection is the issue here. I'm not able to hear you. Sure. Milton, you cut out there for just a moment, but I understand you're asking really about how do we come to the business model that we have and how we approach the evolution. How are we different from other telemedicine companies such as Teladoc? Is that what you're getting at? Sure. So we started with this idea that telemedicine, or the physical connection between a patient and a doctor, is really it's a technology, but not a solution by itself. That we say, literally anybody can quite straightforwardly put Skype in a wrapper and connect a patient with the doctor, but that in fact there's an opportunity, and what we've tried to do, what we have done, is create an experience that makes a more efficient way for people to get answers to their questions at scale without necessarily having to talk to the doctor as the first step. So when we got started, we first started by allowing people to ask questions and then giving an opportunity for doctors to answer the questions. I invited my colleagues to participate in this adventure with us, saying that they had expertise that would help people, and they could help people around the world and at a scale not before possible. And I was really delighted to see the response that my colleagues have to this offer. We had, over a course of a couple of years, we expanded the network to actually reach 100,000 doctors who participated with us answering questions. And we've achieved now... I'm sorry, say again? Yeah, and of course, people finding answers being able to ask a question and get an answer from a doctor for free we did this as we got started in English, but it turns out that we had participation from people in, I think, 120 countries around the world, and we've collected literally millions of questions that are asked, and I think we're about to hit 3 million answers by doctors online. What that means is that there's a library of answers already present, and frankly, most questions, the vast majority of questions are something just like that has already been asked. What that means is that today, when you ask a question, you get an immediate answer, because we can show you the closest matching question that's already in the system that already has answers from doctors, and so you get an immediate response. Of course, if you have a particularly unusual or new question that you want to ask, or if there's some new event, so we're thinking about, for example, the recent outbreak of coronavirus, you can ask a question about such a new topical topic, and there won't be that question may not already be in the system, but we'll send it to the doctors and get an answer. Usually it can be minutes, but usually within a few hours, an answer is available. But we think of this as a starting point, the first place to go. When you have a concern, you can get a trusted answer from a doctor that guides you to really what it is you need to do about that concern.
That makes sense. I guess then, do you plan to, given the scale and the volume of your business, to do something like monetize that question there? Like, for example, there's a company like 98 Degrees where they charge something. I think it's about like $9 or $19 a year subscription. You get these for chat, and they've been doing very successfully. You feel like you're maybe saving a lot of money. Maybe you're not as making, but
It's a good point. We were actually, for the first several years of the company, it was the most frequently asked question, which is how are you going to make money if you continue to offer these answers from doctors and not charge for them? The reality, I think that information which is not personalized, it's not related to your diagnosis or your treatment, but rather information about healthcare should be free. And we have a commitment to delivering such free information around the globe in perpetuity. So when the doctors agree to provide their answer for free, we're putting it into this vast library and telling the doctors that those answers will be available to anyone around the world for free as we move forward. It's quite wonderful, actually. Of course, this happens to me directly. I answer a question, and 6 months or a year later, I'll get a thank you note from someone in another country, because people are accessing those answers over time. And when they see an answer they like, we make it easy for the person to send a thank you note. So that's there. But when you talk about 98.6 and other companies, there's another aspect to this, which is if I need to know what to do for me, and I want a professional to guide me personally in what I should be doing, engaging in my particular circumstances and giving me unique advice that's relevant to me, and taking responsibility for giving that advice, that can be done through text also. But it's a different mode. It's a one-on-one mode, not accessing information in the library, but rather, hey doc, this is what my circumstance is. What do you think I should do? Or do I need to worry about this? Or can you order me a prescription for the treatment of this? That one-on-one interaction can be done by text. And we enable that, and we call that's like healthcare. That's a virtual visit done via text. On HealthTap, you can do that with a live text. You can also do it asynchronously. We have called those inbox consults, where you put all your information into a message and send it to the doctor, and then the doctor responds after the fact. But we think of text just another channel for reaching a doctor for a one-on-one care.
Okay, got it. I guess so. Given the volume of the answer you have already, you feel you're very close to able to just take all the information, create an AI engine, essentially just able to answer, people's questions. You don't even need to have a doctor to answer live.
Well, and there's some companies, not only in China, that attempted to build a system that did exactly that, which is to create text-based answers using an AI engine. And the reality is it's pretty hard given the real-world nature of all the things that can happen. I think that the body, the corpus of those answers and questions and answers that already exist is a hugely valuable thing. We use AI to guide us to understand which is the right question and the best answer. So, for example, when you ask a question, we look for that same question that was asked by someone like you, because the answer to the same question may depend on who's asking. So an 18-year-old male complaining about a headache is going to get a very different answer than a 65-year-old woman who has a history of breast cancer who's complaining about a headache. The question could literally be the same, but so finding the question previously asked, and so you need some advanced technology to get that right, if you will, to balance how close is the question and how similar is the person. So we do use one. But to your point, we also use the knowledge of what people's concerns really are and what conditions they actually have in the aggregate through mining the data of all of the answers. And we do use that as input to guide the development of the AI. It's not strictly a data-driven neural network model, for example. What we actually have is that we built a knowledge model of medicine that is understandable and can be used to explain what the recommendations are. And one more point that's really quite fascinating and really unique for us is that those knowledge models are inspectable by the doctors in our networks. We actually crowdsource the knowledge generation. We look at ideas or facts or points of information in the model, and we crowdsource the evaluation so that the doctors in the network are evaluating and updating the knowledge inside the AI that's driving the system. I'm proud and pleased to say that literally hundreds of thousands of inputs from doctors in the network have refined the knowledge, the specifics, and the calibration of the knowledge inside the AI system that we've built.
Okay, that just seems like incredibly valuable. And we have a question from the audience, Charles. He's asking, so for the AI platforms, like what's your thoughts in terms of build versus buy?
Well, that's interesting. And that sort of implies that there are, I guess the question is who's the provider, right? If you're a healthcare system, I think the buy is the obvious solution, finding the best answer out there. And if you're a technology company wanting to create this, the reality you have to ask is, what is your source of, if you were to try and build this yourself, where would the knowledge and the data come from? These are challenging features, and it's certainly advantageous, I think, for most such to look around at what others have done to incorporate in their system directly.
Got it. Okay. So we have a question from Holly. So she's asking, I guess, are you guys doing anything with things like MD, VIP, or maybe other concierge, like physician services? Because that seems maybe that your knowledge base could be a interesting add-on to those like concierge services.
The fascinating thing about a digital health platform, a virtual healthcare platform that starts with information and guides to doctors, is that the areas of application are really unlimited. There's almost every area of healthcare benefits from having a guided interaction between those who need care or need answers to their problems and the professionals who can guide and give professional services or care is also there. And so the opportunities are boundless, if you will. And the company HealthTap is the starting point we have now is saying, well, there's the concept of the digital front door, the first place of access. We're saying, gee, the most efficient and effective and immediate opportunity here is to create a service in which people can use the service to guide how they gain access to more traditional healthcare. Like, I shouldn't be going to the ER in the middle of the night. Yeah. Unless really, if I need to go, then goodness, it's the place I need to be. But if my problem can be evaluated and determined not to be an emergency through a virtual channel, it's much more efficient to guide someone so that they don't need to go to the ER in the middle of the night. Or conversely, if someone thinks, gee, maybe I'll wait until tomorrow, but let me talk to a doctor tonight, and to discover this could be an early sign of a heart attack or a more serious embolism or something of that nature, to realize that the doctor can encourage people to go to the ER when it's needed. The idea of the digital platform as guiding access to healthcare services is, I think, very powerful. And we have data showing how this actually has an impact when a large employer makes the platform available to their employees. Now, that doesn't mean that there aren't hugely valuable services available. So in particular, I'm excited about chronic disease management. The idea of a less expensive, more frequent interaction that people who have an ongoing condition needing management, monitoring, and refinement of treatment. So classic examples would be diabetes or asthma care for people. And that I believe very strongly that such solutions can dramatically reduce the complication rate and the need for hospitalization and managing problems that, if they're addressed on an ongoing, regular basis, can avoid more serious complications. I anticipate we'll want to do that. We're simply in the phase this year of trying to get the platform in front of the most people possible, making it really easy for an employer to enable access to their employees for this service. It's incredibly cost effective compared to the cost of healthcare.
That makes sense. I guess Geoff, how for your user base, is it primarily in the US? You mentioned a bit globally. What's the split between like a US-based physician and user versus?
So just as the platform can be used in multiple areas of medicine, it can also be used in multiple geographies. Okay. We have made our information service available in English throughout the world, and as I mentioned, we have huge access from people around the world. But in terms of enabling access to a doctor, we are currently live in the States, of course. We also now are live in Canada and in Mexico. So those are the three countries where we have staffed doctors to make them accessible and available to individuals who are looking for one-on-one care beyond the guidance and information that comes free for anyone, anywhere.
Got it. So in terms of like, do you from your business, do you see a tension behind? So, by the way, we see this like when we talk to a lot of the physicians, they say like, okay, I could work for things like HealthTap, Teladoc, MD Live, American Medical System, or I could have my own brand. So in terms of if I work for one of these like big brands, then I actually get to build up my reputation versus if I have to put out my own website doing this, I get to build up my own reputation. You see that tension with your.
It's a really good point. Both are needed, of course. And there's a need for and an opportunity, which is what we're pursuing, which is making the first front door be one trusted door that anyone can walk through that happens to have a brand that people appreciate and respond to, which is just that first point, guiding people to accessing their healthcare. But particularly for ongoing care, as you've described, where you have an established relationship for an existing problem, it really becomes important that the technology platform that enables remote care or virtual care be connected directly with that provider. We have in the past offered such services, although we called it concierge, and there are other competing companies in the marketplace that offer specific telemedicine services an individual can brand. Certainly, I would comment that I think it's going to be in the future very clear that virtual care is it's a routine thing that all doctors in practice will have and make available to their patients.
Okay, got it. So in terms of like the questions you get from the audience and from your user base, do you have something like what percentage are pretty simple, easy to the doctor can answer to well? What percentage are complicated enough? You need to escalate to have a specialist to deep dive. What percentage are so rare that just like you really couldn't answer to these platforms that really need to just.
Well, that's a really good point. I mean, it's certainly true that common questions are common. It's also true that some of the doctors are a bit distracted by the same question being asked over and over and over again. But some of our OBGYN doctors have shared with me that if they see one more time someone asks about what to do with their irregular periods or their irregular bleeding, or the other incredibly common question is, am I pregnant? And the answers are pretty straightforward and they're already there. And so it sort of goes without saying the common questions are common. But at the same time, what the technology does is it offers up the answer to those questions straight away. And then we're incrementally seeing as people, as time has gone on, the questions that end up being sent to the doctors for a new answer end up being the questions that are more refined, more unusual, more different, if you will.
Got it. It seems that do you guys plan to, I mean, I think that piece will be incredibly valuable. Almost do you ever plan to take that piece of license to any doctor? They could just drop it onto their website as a way to handle the common questions and anything complicated escalate to them live. But do you feel like that could be a business model for you guys?
That's a really good question. We've certainly seen some interest from other parties about that aspect as a starting point, and the opportunity to enable or distribute the access to the library through make it available as a widget that another company could put. Although I think most people are using mobile devices these days, and it's a bit harder to incorporate such widget-based access inside other mobile applications. But we're certainly open to spreading the information from the library, sharing it. I think of it as a large, important global resource rather than as the foundation of our business model. I should mention, as a company, we've never taken advertising or sponsorship revenue from any healthcare partner, from pharmaceutical companies, medical device manufacturers, or even healthcare providers, because we wanted the information to be as unbiased as possible and didn't want to put ourselves in a situation where we needed to present information at on behalf of a sponsor or advertiser.
Okay, got it. But in those cases, you can still do it almost like the NPR model, right? Have some underwriting, but still have some hands way of this, and not to influence your content. Right?
Just feel like we're certainly not a nonprofit. We are not a nonprofit. We are a for-profit enterprise, but we decided that what we wanted to do was enable healthcare services, which would be paid. And when a doctor gives care to an individual, someone needs to pay for that care, whether it's the employer or the health plan or out of pocket for the individual. And that when healthcare is delivered, then there's an opportunity for us to charge for the use of the platform to do that. And that the rest of the service is really all the other things needed to orient and make sure that people are gaining access to the right doctor and getting the right care. So we'll make our money delivering the right care in a more effective way rather than trying to monetize or sell advertising related to the content that doctors have shared with us.
Makes sense. So I have a question from the audience, Ram. So he's asking for, so how's the HealthTap handling the liability issues based on the answers provided? Like, do you malpractice insurance, how to cover it? I guess, how do you make sure the answer that's delivered is actually accurate and high quality?
This is actually something on the minds of many providers in particular. As doctors in America, we're particularly sensitive to the realities of malpractice capability opportunities associated with practice, and so it's a concern. Now, interestingly, on the information side, the free question and answer side, we've managed this by not positioning the information as specific medical advice for any individual, but rather as reference source information and not guidance for what someone should do. We've done is we've reduced you can only ask a question of just a few hundred characters. You can't provide a story or present a clinical case for review. And the doctors are instructed to really only give informational answers that would be relevant to anyone with a similar concern. Now, nevertheless, there are some doctors who are still concerned about the potential for being held accountable for their answers, even though, the best analogy I can think of is the author of a medical textbook. And I'm pretty sure no medical textbook author has been sued for the advice given on the treatment of a condition written on the page for that condition. And in many ways, that's the model. But because doctors were concerned about it, we went to Lloyd's of London and we got a special liability coverage policy, general liability. And so doctors, even when they're giving free answers, are covered by this policy. Now, it's very different when it comes to giving virtual care. One-on-one health care that's paid for is very much more aligned with traditional medical care for which a standard medical malpractice insurance is required. It turns out that the risks associated with, or the liability associated with giving virtual care is probably significantly less than the liability associated with in-person care. And I think the insurance carriers reflect that in the rates they give us that allow us to enable liability insurance protection for our doctors for a single dollar per consult and independent of the specialty of the doctor. So it's included on the platform, and any doctor who is giving care has that as a supplement, or if they don't have their own policy, it's a standalone policy for liability. So the reality is that the total number of liability or malpractice cases associated with virtual care is vanishingly small, and it's much less than people's fear. And the concern, I think, is driven by the uncertainty and the fact that it seemed to be something new, even though the numbers and the objective measurement shows that the risks are actually pretty small.
Got it. I guess if it's outside of the liability aspect, do you have a team of physicians that review the answers that's provided to, because maybe there's certain thing, even there's no liability, there's maybe a wrong answer or something.
There's a couple of ways of looking at it. One can look at it from a concern related to liability. I prefer to look at it from an issue of how do we ensure the highest possible quality. And how do we give people confidence that the information they see is high quality? What we've done is we've systematically included physician peer review in everything we do. So in some ways we gamified it from the beginning. When doctors they see questions to answer, and they give answers, but they also have a feed of the answers that their colleagues have given to questions. Okay. We call it peer review. We allow doctors to read the answers that other doctors gave to questions and then to weigh in on whether they think that's a good answer or not. Okay. It's an agree button. If you agree with the answer, you hit the button. And to my delight, what I discovered is the doctors gravitated toward that almost more than they gravitated toward giving fresh answers. The doctors are learning from each other, and they're learning a variety of things. They're learning what their colleagues think about a problem where they may themselves be expert, but they're seeing what other doctors think about the same problem. And what that means is we expose those peer reviews to the users who see the answer. And so when you see an answer on HealthTap, it shows you all the doctors who agreed with the answer. You can actually look at the profiles of the doctors. Not only the doctor who gave the answer, you can look at the profile of the doctors who reviewed the answer and see whether they're trustworthy doctors who have weighed in an agreement. And it's been really marvelous to see how doctors have stepped up to providing peer review to guide people to the best answers to questions on HealthTap.
That's wonderful. It's almost like you're not just getting one doctor, really you're getting all the doctors approved there. That's actually giving the ultimate source of truth.
It's been rewarding to see. And as I say, doctors are, even the true experts in the field are using this as a means of understanding what the collective opinion of other doctors is on any given topic.
Got it. Can I ask, so typical doctors always like they're very busy, right? They're like typically their day filled with, like doing EMRs, all the different things. Like what's the motivation for a doctor to provide free service? Is it just they can get referral to do the paid services? Is it a pure reputation? Like I get why would they do this when they're so busy already?
That also is a very common question we get. In fact, when we got started, people told us not to bother because doctors would never do it. We laughed that if we had a dime for everyone who told us that it wouldn't possibly work, we would not have needed any investors in the company. But the reality is that there's actually a variety of reasons that doctors do, and different reasons appeal to different doctors. They run the gamut. A lot of doctors do this as a sense of commitment or giving back, if you will. In the bad old days, doctors used to spend a half a day a week giving free care in their communities, and that happens a lot less these days. But doctors still have this underlying desire to help others with their knowledge. But that's not by far the only reason. In fact, doctors do it for a variety of other reasons. They include, for example, that you learn through the process. When you read other doctors' answers, you are learning about the information that the doctors are presenting. Another aspect is that the doctors who are giving an answer know that that answer is going to be there and available to others. So it's the scale with which their knowledge is being distributed is large. And then when we look at the more sort of personal reasons that drive the behavior, you realize that doctors are creating reputations for themselves. There's an online reputation and the ability to be found in the online world, which really does direct. There's some, in some cases, I'm sure there's ego involved, but in others, it's more a matter of establishing a reputation and allowing people to find them and come and see them. We certainly see lots of doctors with individual strengths or areas of interest finding patients with that same problem because they're the expert on HealthTap on that particular problem. There's other things we allow doctors to earn CME. We give free CME. If you can't, it turns out, get CME for giving an answer. That's just practicing medicine or using your knowledge to help others. But if you learn, if you spend time learning, so we've incorporated an automated search of the medical literature. And so a doctor is looking at a question they might not know the answer to, can do an online search on the spot, read about and learn about it, and then get CME credits for the process of learning in order to help someone. In fact, we have doctors who use the platform as their guided educational source. Like they look for questions they don't know the answer to, and they know those questions are relevant because someone asked them, and then they go learn about it in order to update their medical knowledge. So they're using the site as a way of maintaining their currency and their understanding of the current medical issues.
God, okay, that's quite wonderful. Actually, I didn't know about that part of your business. I always thought it was more like a consumer facing. But that makes a lot of sense. So we have a question from Brenda. So she's asking, so what are the limitations of virtual interaction? So for example, you cannot do a physical exam. What are the ways you maybe either get around that issue, but how do you just still provide care?
Sure, that's also a very good question, very relevant to that whole notion of what it means to do virtual care. We actually created a course to guide doctors to an understanding of how to address this very situation. But what it comes down to is that doctors are used to practicing in different settings. The things that you can do in the operating room are very different than the things you can do in the emergency room. And that's different from the things you can do when you're in an ambulatory care practice in an outpatient clinic setting. And in each venue where you are, you evaluate the person to see what they need. And if you can manage them in the current setting, you do so. If you can't, You get them started, you do the temporizing steps, and then you refer to proper care. If you're a GP and someone needs to see a specialist, you don't try and treat the problem, you refer them to the specialist. Similarly, in virtual care, there's a whole array of things that you can conveniently and appropriately do and manage, but there's other things you can't. And so recognizing that this problem requires a higher level of care or a different level of care is part of the job of doing that evaluation. And of course, you can guide the person to an understanding of what the things might be or why it is they need to see a specialist or go to the ER or have an exam in the office of the doctor. And then you can also, of course, give guidance about how urgent it is. Hey, you need to go right now to the urgent care center to get that stitch, to get the laceration stitched up, versus, this is a problem. Take some acetaminophen today. It's 1 o'clock in the morning, but you can call your pediatrician in the morning. And as long as he can see you during the day tomorrow, that'll be good. If he can't see you during the day tomorrow, go to the urgent care tomorrow. But you don't have to go to the emergency room right now. Okay. That kind of guidance is very helpful and easily distributed through the virtual care interaction.
I get this. I have maybe a two-part question. The first part is, so are you happy with how much money HealthTap is making? And then the second part is, what are some maybe new business offering or ways you guys will monetize this year that you guys maybe will introduce?
Well, as a growing company, we're always happy to have our revenues increase. We're very pleased with where we are right now. To give you some insight into how we're going to allow more and more people to gain access to the platform, we are focusing on the benefits that the platform provides and to those individuals or the situations where those benefits are realized. So an employer that is self-insured, any employer with more than a few thousand employees, is fundamentally paying for whatever healthcare their employees require. And such employers greatly benefit from the platform when their employees have access to it, because not only do they benefit from the reduced healthcare costs associated with more efficient virtual care, they also get more time at work, less time off work, associated with people that can get the problem solved virtually and don't have to take the hours off it takes to go and see a doctor in person. So the employer very much benefits from that. There's another area, we're focusing also, this is something recent for us, which is in the gig economy, there are an awful lot of part-time workers who really don't have any health care. Yeah. And having access to the virtual care really guides them, particularly if they're going to be spending money out of pocket when they do need to see a doctor in person. If they can have everything that can be done virtually done, that's a huge savings to them. And it turns out not to be that expensive. We offer an annual subscription. It's $119 now. And that gives a person unlimited access to the platform for a year. Okay. And so for less than the cost of a single outpatient visit, they can have as many virtual visits as needed and guidance so that they only go to get more expensive care when it's actually needed. We're also announced last week a partnership with Cerner. As you may know, Cerner has traditionally been a health information system company, but they've grown into a healthcare company, and they're offering in physical clinics for large employers. And so together we're now able to combine this offering so that an employer can offer an on-site clinic integrated with virtual care. So their employees can access virtual care initially and then have a clinic to go to, or they can start by going to the clinic and then do follow-up or routine care after the fact virtually through HealthTap. So we're very excited about that as a partnership that's showing a different way, a better way of delivering more integrated care for employees of covered employers.
Okay, great. Wonderful to hear all the different ways you guys will be making money and be even more successful. So right now, like in terms of going back to the AI, right? So the IBM Watson's been around for a long time in there. Do you feel like they have delivered on the hype, or maybe they have under-delivered, or like what's going on with them? Yeah.
Well, you're asking me to comment on what might be a competing service. But I would comment that the Gartner curve of hype related to AI as I think we're pretty close to the peak, if not just a little bit beyond it. And IBM jumped in a big way early on. They had a massive success with their Jeopardy win, which they created. But the reality was that the technology they used to win in Jeopardy is not the technology they're delivering in IBM Watson Health. they're delivering and they're a very powerful organization with lots of important resources, but they were trading on the market force of the Jeopardy win to create new solutions that really weren't built on that original. And they certainly had some pretty high profile implementations where some reasonably successful, others less so, where it seems clear that the promise and the cost associated with how they tackled it were not well aligned, if you will.
Okay, got it. What about what's your thoughts on the Google having access to essential healthcare data? And then do you feel like would there be enough patient pushback to have an advertising company essentially to have access? Where you feel like eventually people feel comfortable, there's sort of a security and
I think it's up to large corporations that are offering information infrastructure services in healthcare to prove themselves as reliable, trustworthy, highly secure, and able to maintain the confidentiality. And I think we're seeing in the marketplace different players that have achieved different levels of recognition in that regard. The Google Ascension Health, as far as I can tell, in theory, is a cloud platform provider delivering services to a healthcare provider. But it's clear that greater transparency needs to happen around what access to health data they have and how it's being used. It is certainly, in my opinion, there's a huge opportunity to build systems that are based on the aggregate data from large, build AI capabilities on top of the data that come from the integration of large healthcare systems. But the use of such data needs to be, I think, transparently described, and people need to have confidence that the information is being used in an appropriate way to guide systems that improve care rather than to target or leverage or take advantage of any individual's healthcare situation.
Okay, that makes sense. So one of the things, when we, a lot of the people we work with, they always struggle with, they think through how to decrease the cost of healthcare in a big way. So assuming is, let's say, everyone in the United States, they deploy HealthTap. They have HealthTap in the fingertip. It's just this is the foundation of it. Okay. Do you have a sense of how much the decrease in healthcare will impact? Of course, the context, healthcare insurance premium is really, really expensive these days.
Sure. I mean, the discussion about why is our healthcare cost so large is an interesting one, and we could spend more than all the time on this call covering it. At a first level, I mean, fundamentally, healthcare costs too much in this country. The prices are too high, and I don't know that we directly address that. But we do address is a very important other part of where do other cost excesses come from, and they come from care being delivered that isn't needed, the overuse of services that aren't actually helping people. And they come from the administrative overhead and the costs associated with delivering that care. So we spend an inordinate amount of money administering the spending of the money. And the digital health platforms offer the opportunity to streamline that in a powerful way. And on one side, and they also offer the opportunity to reduce the unnecessary care. And related to that is this idea that if you put all of the care in one place, you can make the care that's delivered more efficient because doctors aren't repeating tests, the test results are available, and doctors have a better picture of what's going on if the data are all available. And so we didn't talk about this, but one of the features of the platform is when someone has an account or a profile on HealthTap, there is a personal health record that includes all aspects of the care they've received. It also includes their health-seeking behavior, so a doctor can review what other health concerns the person has as expressed through the health information seeking that they've done on the platform.
Yeah, that makes sense. Geoff, I really, really appreciate you spending an hour with it. This is an amazing conversation. For some of the audience member, apologize we didn't get to all the questions, but we'll see them. We can do the recording with them. But then I guess as we wrap up, if I can maybe ask you three a rapid fire question. The first thing is you share a lot of really interesting insights today. What is this one the most important thing if the audience member could remember one thing from what you shared? What would be that thing?
Well, as Gibson said, the future is here. It's just not evenly distributed. what we're going to see very soon is the acceptance and distribution, or the availability rather, of virtual care. It will be the normal thing, and in fact, in a not too distant future, people would not think of going to a doctor that didn't have the opportunity to give virtual care, because we see a doctor that didn't have a telephone. It's going to be a really basic part of how healthcare is delivered. It makes so much sense. It's so efficient, and it's effective, and it costs less. How could it not be something that we'll all be using?
That makes sense. What about the next question is like, so man, you've been like a legend in the whole digital health industry, right now, from WebMD to health and so on. What is this like one thing that you believe now about like telehealth virtual care that the rest of the world do not believe yet?
Well, I think it is just what I said, which is that I believe that telehealth will be the standard way for people to interact with their doctors, and that visiting the doctor in the clinic will be the relatively less common way of interacting. It will still be needed, and the hospitals will still be needed, but for the vast majority of people, the 85% of people that don't have a significant concern, that their access to healthcare will be through remote technologies rather than in-person care.
Okay. Although I think for that one, maybe like more and more people now believe. I certainly agree with.
No longer controversial, is that right?
No, it's controversial. And then the final question is: suppose you have this magic wand, and you could just wave it, then you could just anything you want. You can just make this one change within the U.S. healthcare system. Like, what would be that change?
I believe pretty strongly that the biggest problem we face in this country is the number of people that don't have access to care. And if I could wave magic wand and make access to healthcare available to everyone in the country, I'm very confident we as a nation would be way better off.
Okay, awesome. In that case, I think the magic wand, sure everyone would have the HealthTap on their mobile phone, and
I didn't say that. I said we needed to have access to healthcare.
okay, but HealthTap would be the way to get.
It would be a great first step, and we're making that possible for all of the gig economy employees who don't have any healthcare already.
That makes so much sense in there. Doctor, thank you so much for this spending time with us. Like, I enjoyed it quite a bit. I learned a lot from you. Again, thank you so much.
Milton, my pleasure. Anytime.
Thanks.
And I'll send you some pictures.
Okay, awesome. Okay, yeah, we can post it with share the recording of your hang gliding adventures.
Thanks so much, Milton.